Hi, I'm Dr. Catherine Walsh, a clinician scientist at the Hospital for Sick Children in Toronto, Canada. And this is my colleague, Mr. Michael Scaffidi, who's a research coordinator at St. Michael's Hospital, also in Toronto. We recently published our study in gastrointestinal endoscopy entitled Impact of Experience on Self-Assessment Accuracy of Clinical Colonoscopy Competence. This is a prospective observational study that was conducted at 5 academic centers in Canada. So first off, Michael, can you tell us what's the importance of self-assessment with regard to gastrointestinal endoscopy?
Yes, absolutely. Thank you for the kind introduction, Catherine. Self-assessment, as the name implies, involves the evaluation of a given skill in any domain. Self-assessment is acknowledged as an important skill in gastroenterology. It allows physicians to identify their own strengths and weaknesses to inform them where they need additional practice. However, it is unknown whether physicians can accurately assess their ability to perform colonoscopy.
Thank you, Michael. Can you tell me a bit about how this study was conducted?
Yes, absolutely. As mentioned, we conducted a cross-sectional study at 5 academic hospitals in Canada. We recruited novice, intermediate, and experienced endoscopists who each completed a clinical colonoscopy. After each procedure, the endoscopists rated their own performance using the gastrointestinal endoscopy competency assessment tool, or the GIE-CAT. In addition, they were video recorded, and these video recorded performances were assessed by 2 blinded raters also using the GIE-CAT. Then, their self-assessed scores and the scores assigned by the external raters were compared to determine the overall self-assessment accuracy.
Thank you, Michael. Can you tell us a bit about what you found in the study?
Our findings are in line with literature from other domains. Specifically, we found that self-assessment accuracy tended to increase with experience. The experienced endoscopists tended to underrate their performances, and novices tended to overrate their performances. This is in line with the Dunning-Kruger effect, in which novices are unskilled and unaware of their performances, and thus tend to have poor and inaccurate self-assessment. Not only did we have participants assess their technical competencies, but we also had them assess their cognitive competencies and integrative competencies such as communication and situational awareness. Interestingly, although experienced endoscopists were most accurate in their assessment of cognitive and technical competencies, they were the least accurate in the assessment of their integrative competencies. There are 2 main study implications. First, we caution against the use of self-assessment among novices for assessment-related purposes. However, during training, it is important for novices to practice their self-assessment skills. Endoscopic trainers can then review their self-assessments and provide constructive feedback to help foster self-reflection and to help develop a more accurate perception of their strengths and weaknesses. The second implication is with regards to experienced endoscopists. Specifically, self-assessment is likely a useful strategy for them to help identify their learning needs in order to create self-directed learning plans for continuing professional development. However, our results indicate that experienced endoscopists lack insight into their integrative competencies, which are known to be a significant contributor to GI procedure-related adverse events. Educational courses that provide structured assessment and feedback for practicing endoscopists with regards to their integrative competencies may be beneficial to promote self-awareness.
Thank you, Michael. Is there anything else that we could do for novices to try to help improve their self-assessment ability?
That's an excellent question, Catherine. In other domains, video-based feedback has emerged as a useful tool for improving self-assessment accuracy, especially among novices. However, the usefulness of video-based feedback to improve self-assessment accuracy has not been studied in the context of GI endoscopy.
Thank you, Michael, and thank you to everyone watching our video. We hope you enjoy reading our study.